probably time to get started. Yeah, we're going to start with Kurt and go from there. Good morning, everybody. Welcome to our informal Senate budget and legislative budget hearings, if I may say so. We'll be bringing in the next 2 months, July and August, several of the agencies to give them an opportunity to make presentations and for questions for the legislature members to, how can I say this, educate ourselves on the status of where we are on the state with the agencies. As I mentioned, these are informal hearings. There's no quorum needed. There is no votes to be taken. There's no decisions that are being made. This is information only. We appreciate everybody's interest. We appreciate everyone being here. Anytime we have presentations that's put up, we always ask that those presentations be made public and also be made online, and also if we can get paper copies, we'll do that if we can. So all of this is public information. So having said that, Admiral, we're going to start, if you don't mind, with LSA and Kirk Fulford to present us a status of budget and matters initially, so we can get an overall view.
Absolutely.
And then we'll have you come up immediately thereafter.
Yes, sir.
Is that all right?
Absolutely.
All right. Now, for everybody on the podium here, we have paper of what his presentation will be. We also have other data up here for those of you that have reading glasses. Kirk?
Yeah,
Have at it.
I got some. You need them?
I might, yes.
All right. Before I get started, I want to take the opportunity, because I don't do it enough, to recognize my staff. A lot of the stuff you're seeing is stuff that my staff put together, and I want to make sure that you can actually see them. Sometimes they don't want to come out of their office or come to see you, but stand up. This is the fiscal division staff. A lot of smart people there. They make me look good most of the time. It's pretty hard to do.
That's a hard job, guys.
That is a hard job. Thank you.
Thank y'all to each of you. Appreciate your support.
So we could title this "What Keeps Me Up at Night" if you'd like to. We'll get to that in a minute. First thing I want to do is make sure that you received an email from me dated July the 3rd. I was announcing something that we were doing new on our website. It's called the Fiscal Dashboard. You access it through the main front page of the website. There's a tile on it that says Fiscal Dashboard. We sent you the contents of that in that email, but essentially what we're going to be doing is adding information periodically to that portion of our website. Initially, what's on there is the 2 slides that I'll show you in just a second, which are basically a rundown of the budget conditions. It's a month-to-month, what happened in June versus where we are today for both the Education Trust Fund and the General Fund. What we intend to also put out there is information that you might find interesting, such as a rundown of historical receipts for various revenue sources, a rundown of receipts and expenditures to both budgets on a historical basis, and just other things that might pop up from time to time that you might find interesting, such as we've got an infographic in the works regarding the K-12 Foundation Program. We've got a group looking at revising that, and there's a lot of misinformation and a lot of things going on about people trying to understand how that works. We've got a nice infographic that's going to show you the entire process or entire rundown of how the foundation program works, and some other things, but it's something that I hope you'll find useful, and also have the opportunity in that email to let me know if you want to continue to receive the email that lets you know when we put stuff out there, or if you don't want to, that's not going to hurt my feelings. We're still going to put stuff out there. So we'll send the email again August the 1st when the new receipts reports come out, and if whoever we haven't heard from at that point that wants to continue to receive them, I'll just want to email you. I'm not going to bombard you with emails every time we put something out there unless you want it. So if you want to be on the list, just let me know. So what's out there right now is this. This is an infographic that discusses, this is Education Trust Fund. This is the monthly analysis and highlights of the Education Trust Fund for June of 2024. It runs down the biggest changes, the biggest revenue source changes, and also the monthly highlights get into a description of what really happened. There's a lot of this stuff, if you don't look at it on a day-to-day basis, you can't decipher heads or tails about what's an outlier, what's a normal situation, what's not. Case in point, in June, there was the one-time receipt of a $30 million transfer back into the Education Trust Fund from the repeal of the Distressed Higher Education program, which you passed a law to make happen, but that's why that revenue source went up by $30 million. And if you didn't know that, you would assume that that was real growth. It's not real growth. That was a one-time anomaly, which I try to point out, and we're going to continue to try to point out on these going forward. We do something similar for the year-to-date. Year-to-date basically shows you total receipts up by 1.67%. And then the bottom right-hand corner shows you where you are today. In other words, you have a beginning balance, you know what you've got year-to-date in terms of receipts, and how much more revenue do you need for the rest of the year to support that. Simple math is you don't need growth in the Education Trust Fund budget to support remaining expenditures for the rest of the year. That's a great place to be. Historically, going back 15, 20 years, you couldn't say that. We were sitting here hoping that we get 5% growth in the last 3 months of the fiscal year so we could pay all our bills. We're not in that situation right now. Similarly, on the general fund side, we have same information. Month-to-date receipts for June, those are the items that grow. One of those things that is an outlier is the abandoned property number. Historically, those funds come in on a quarterly basis. We're a little off kilter this year. Nothing wrong with that, but that's a 1 month outlier that will catch itself up in a later month. But we try to let you know those in the monthly highlights. We didn't do that one because I wanted to point out a couple of other ones. Interest on state deposits, you're going to hear a lot about that in this presentation. I'm going to harp on that, and I hope you understand that that's what keeps me up at night. And I'll explain why in a few minutes. Year to date, we're up 10%. That's way above what we thought we were going to be at this point, and also year to date, simply because of the interest on state deposits. Every economist in the U.S. had predicted well before now that the Fed was going to reduce interest rates. Everyone assumed that was going to happen at the start of the year. Then there was an assumption it would be March and then June, and now on my Fed app from the Atlanta Fed, 92% certainty that in September there will be a rate cut. Didn't say how much. I think we could all assume it's probably going to be what they initially said of a 0.25% rate cut to a 0.5% rate cut, and maybe they slow walk. Because they slow walked up, maybe they'll slow walk down. The other side of that is, what if they don't? What if they decide to, for whatever reason, knock a whole basis point off or 150 basis points off? That's a different story, and I'll show you why in just a minute. But again, the similar information year to date. We're going to do these on a monthly basis. We do them anyway. We're just going to share them with you, and I wanted to make sure that you understand the receipts information is public information. It's on a public forward website, on the finance department's website. The press sees that. They know the information's out there. This is our attempt at making sure that you know what they actually mean so that you can be up to date on a monthly basis as far as where we are and hopefully where we're going in both budgets.
Kurt, can I ask you a question?
Yes, sir.
First of all, thank you for this. I love these dashboards, and thanks so much to your team for what you do for us all year round. But I guess on top of those rates dropping, and with the money that was allocated to the A&T through the ETF this time, so we're going to have less balances anyway than we currently had to draw interest off of. So it's kind of a double whammy. That's
absolutely a key point. And I've got another slide that'll probably be a better explanation of that, but you're right. I've got a historical piece I'll show you in just a second. It's got a really big dip on it. So why is interest on state deposits so important right now? So historically, we've gone back, and I can go back as far as 25 years and look, we have never, ever, ever had interest on state deposits approach $400 million. We had it at 136 about 10 years ago. And outside of that, if you go back to 2021, it was 19, and then it was 40. Prior to that, we had 52 and 60. So it's fluctuated right in that less than $100 million range, and then all of a sudden, $404 million. And oh, by the way, your general fund grew by 16% in 23, $364 million of that $461 million in growth was interest on state deposits. That's great. That's wonderful. It helps your bottom line. Problem with that is, if you pull that number out, everything else only grew by $97 million. That's 3.5%. Average growth over that period for everything else is a little less than 4.5%. So it's still a little less than normal for 23 for everything else except interest on state deposits. Again, don't miss the point. General fund's doing great. General fund needs no revenue growth for the rest of the year to support what you've already obligated. But let's figure out where we're going. We went back 10 years. This is, lots of colors. I wanted to highlight the fact that I told them to highlight the 5 largest revenue sources in each one of the fiscal years for 10 years.
Kirk,
And throw everything else into all other. Yes, sir.
I don't mean to interrupt, but I'm colorblind.
I'm sorry.
Me too. But so I'm listening to your explanations.
Pay attention to the one on the far right that's circled. That'll take you to the honeypot, so to speak. Anyway, the bottom portion of the cigars, and I hate to call them that, but that's what they look like to me. That bluish color is insurance premium taxes. That's the largest single revenue source of the general fund, and it has been, and it probably will be, historically, at least for the last 10 years. It's roughly 19% of the total receipts of the general fund. Obviously, if you look, beginning in 2021, the blue color, halfway up is simplified seller's use tax. So it's a large portion of the general fund as well. The orange color is the regular use tax. And then the far right, and the point I was trying to make, is 2023 revenues. And if that green color is the only time you see in that 10-year period interest on state deposits being one of the top 5 revenue sources. And in fact, it was almost 12.5% of total receipts to the general fund for fiscal year 2023. Going to be in that direction in 2024. That $404 million in revenues from that revenue source in 2023 has already been surpassed through 9 months in the current fiscal year. It's $419 million through 9 months this year. So the largest single year we've ever had on interest on state deposits in 23 has already been surpassed in fiscal year 2024 with 3 months left and no indication that the rates are going to be cut before the end of the fiscal year. So we're going to establish a new revenue high this year, possibly approaching $600 million. But that's a problem. Here's why. So what's happened since basically after the first quarter of 2022, the Fed began increasing interest rates. At the same time, they also allowed us to start receiving the interest on some of the federal money that we had invested. So we put more money into the short-term investments. As that went up, we're receiving more of the interest on it. We're just taking advantage of the opportunity.
Was that a change? The Fed allowing us to
Yes.
gain?
Yes, we traditionally are not allowed to do that, but they changed during that period, so it helped everybody.
Does that, and do we anticipate that change going back on that, or do you know?
I refuse to guess what the feds are ever going to do.
Good point.
I have a hard time projecting ours. But so that's had a major impact to Chairman Reynolds' point. if you go back to the previous slide, all the way back over to 2017, on interest on state deposits, we only had deposited about $2.9 billion. At the end of 23, we had $11.5 billion invested. So it's not just the interest rates, it's the amount of revenue we've got on hand that are invested that's drawing down the interest. All of that plays into why that number is so exponentially higher than it ever has been. But what goes up clearly must come down. This is a better indication of what I mean. The gold line there, the only line there, Chairman Albritton, the line is the receipts. You can see how that tracks pretty much with where the rate was. You look in 2020, that rate went from a little above 1 to down to basically 0. You also see how that tracked with our revenue growth during that period. The flat line there at the bottom was when the rate was basically 0. Now watch it go up. That's a product of the rates going up as well as the amount of money we have invested, and that's where we are right now. So it's really telling to see how they play together and get you to a point of having an extremely large outlying revenue source that's, you know, something that can't be dependent upon going forward. That's my point. Understand, I love the growth. I love the double-digit growth. Never didn't project it because we thought that number is going to drive you up and down for the next few years. But it will eventually come down. And thankfully, you have not been spending in your budget in a way that would make you have to continue receiving that amount of money. You just need to understand that that has to continue because you won't have the big leftover balances going forward in the next couple of years that you're going to be able to do the huge supplemental appropriation bills with. There will be leftover money, but it won't be of that nature, it won't be that amount.
I got a question for you. So I think that means from hearing that, then eventually, you're right, this is going to come back down, which is more important for us to keep other things in check, such as SSUT and things like that, and not looking at spread net and start losing from that flow of income.
It's
as well,
everything.
correct?
I mean, I get concerned about some of the tax credit programs that draw upon general fund revenue sources. Understand, yes, if they generate jobs and new jobs and this and that, new jobs and sales tax revenue goes to the other budget. You don't receive the benefit back from the credit that was provided, except in the form of ad valorem taxes, and the general fund gets about 15% of all ad valorem taxes levied in the state. It doesn't replace what you're giving up.
That's where you should go. You know exactly what I was talking about. Making sure we protect this, in my opinion, 100% within the general fund going for it.
Yes, sir. You need to know this is going to happen, and also know that there are things that you have other control over that you probably need to keep a better handle on.
If
You
I
got a
may-
handle on your spending.
If I may
Right now.
point out also, you're emphasizing the rates, which they're going to change at some point. We don't know when and how that's going to change. But the other aspect of it, as Chairman Reynolds brought out, is the amount that we have on deposit, which is mostly federal money, ARPA, CARES, and
large-
other monies that's come in
large portion.
that is to be spent, not appropriated, but to be spent by December of '26. That money is now in the process of being spent and coming out of the coffers, which is going to cause, between now and December of '26, a huge decline in the amount of monies that we hold on deposit. So regardless of what the rate is, just the amount that's available to earn interest on will be in significant decline. And we know when that's going to occur.
It absolutely will, and that's a large portion of what has been invested. And understand, there's other things there too. I mean, the treasurer's pretty bright. He'll know how to manage this when the rates start going down. If there's an alternative investment that he can make more money in, as opposed to just, the 5% standard, market rate, he'll move money over. So you're right to that point. We're spending it down over the next couple of years and through other processes. But there's also other things that have to be, and the timing and the amount of the unwinding is going to be a kicker too. If anybody can predict that over the next couple of years, and with the change of possible change of administration.
Senator Elliott, go ahead.
Kirk, if I can, of that 11 billion that's invested, how much of that is, or are rather, funds that are to be expended? So what's the oil and gas trust fund that we're not supposed to spend? But then what percentage of that is the federal funds that we
Yeah,
expected?
the oil and gas trust fund would be a separate.
Okay.
because they have
As an
their own
example, though, that
Yeah. Obviously, the ARPA money we've allocated but hasn't been spent yet, some of that's can be invested. Obviously, has to maintain enough cash to be able to pay the bills as they come due. You can't really get rid of an asset too quickly. So a lot of that is federal money that's already in the pipeline that, are still in the process of being facilitated. But don't miss the point that our budgets are also exponentially high. They basically maintain the balance of what we need to pay the bills, and then they can invest the leftover. So it's basically all of that, and it's internal monies of agency. Any fund that doesn't say otherwise can be invested, and the interest earned on that goes to the general fund.
okay.
So my smart people, we have a new product, and they are using that product to basically project out future years. So here's what this shows. This is everything else but interest on state deposits. And if you can tell, the projection looks like the number is leveling out in terms of growth. That's to be seen, right? I mean, we were exponentially high over the past couple of 3 years, and so the growth rate is going to come down. And that's what this is showing. That's everything but interest on state deposits. We've got an upper level, a lower level, lower confidence level, and then what the actual forecast is. And that forecast, as far as growth percentage, is coming down to what the actual normal rate would be over that period of time. Keep that in mind. Here's what else this is. This is not any attempt at an official revenue estimate or projection over the next 5 years. This is Kirk's attempt at a what if.
Can you go back to the previous?
Oh.
No, there. I want to emphasize where the forecasts, the trend, the reversal of the trend, if you might, that in all of these, whether it be the forecast of the growth or the confidence, all of them have a downturn. You're forecasting that revenue is going to go into decline.
Slow down.
I apologize.
Not a negative growth. Well, depends. I'll show you that in just a second.
All right.
This is, like I said, this is everything but interest on state deposits. And yes, that growth rate is expected to come back down to a more normal growth situation. Going back to 2009 and 2010, we all know what happened there and why that revenue dropped off. You can see the spikes. Obviously, after 2020, you see the big spike. That's out of the ordinary. This is coming back down. The projection's coming back down to something more ordinary.
All right. Nothing dramatic, but certainly some type of reduction anticipated. All right, thank you.
And Kirk, on that draft, if you would, so the way that plays out there, is that hitting the 26 budget, 27 budget? Where does that end there in the middle of that draft?
It's actually going forward to 2030. If you take.
Oh, okay, so it stopped. I thought it wasn't going all the way to 30. So.
Yeah, that line goes all the way out to 30.
Okay.
And it's just a trend analysis of where the projection puts all the other revenue sources other than the interest on state deposits. Now, there's obviously things that are not factored into any kind of model that you do. These one-time outliers, I think you are aware of one that we know about now. They're not, you can't model that. Obviously, it's one-time situation that'll pop up. But this is the next chart. So this is not our attempt at projecting interest on state deposits. This is my attempt at showing you what could happen going forward, 25, 26, 27. So the left column of numbers is basically the dollar figures associated with the previous chart. Everything else except interest on state deposits. That 2024 number for interest on state deposits is not going to be too far off from where it'll end up. So you're looking at about 3.5 billion in revenues. That's, it'll approach a 10% growth rate, which is where it is right now. Now, going forward, how does the unwind happen? How quickly? So look at 25. Again, that's everything else except interest on state deposits in the left column, and then there's a column for interest on state deposits. What happens if they pull a whole 100 basis points? What happens if they go a half a basis point? That's a $200 million hit, and if you look at the total revenues for 25 and 26, they go backwards. Even with everything else going forward, it's not by enough to outpace going backwards. I point that out to let you know that it's really critical about the timing of how they unwind and how much money we have on deposits and what kind of impact that's going to have on your budget, because it could be worse than that. If you go back to 2020, in March of 2020, there were 2 rate cuts totaling 150 basis points. From that point to the end of the fiscal year, interest on state deposits dropped off by almost 50%. From where that number is going to end up, if that happened, you'd blow a $300 million hole in your budget. So I'm not trying to scare you. I'm not saying this is what will happen. I was just trying to show you possibly what could happen. And again, the timing of that, the amount of that is going to be dependent upon the cuts and the amount of money we got on hand and on deposit at the time that it happens.
And this is not talking about anything dealing with economic recession or economic growth or anything of that nature, an anomaly that may occur in whatever. This is simply dealing with the amount of deposits and the interest rate, meaning that we're only talking about interest on deposits, correct?
Mm-hmm.
Okay.
The potential impact that change, that eventual change will have on your bottom line. Obviously, if the rate cuts result in kicking up the housing market and kicking up, the other stuff, their leasing and other revenue sources that might be impacted positively from that, those things would have been factored into the trend line for the previous 10 fiscal years that were factored into the growth projections going forward. Again, those are just forecasts based on what the system is telling us. And those are my attempt at trying to show you what a potential unwinding could look like. I'm not saying that it will. I'm not saying that's our projections. I was simply showing you what could possibly happen. And with no growth, potentially no growth in 25 and 26, you're good. The budget that you passed for 25 was $3,360,000,000, but you're going to have a big ending balance. So even with the extra $248 million, that number's 3.6, you're probably going to have north of $500 million ending balance. Good. What's not going to happen going forward is you're going to have $500, $600, $700 million ending balances. I just hope you understand that. And because of that, the potential for big supplemental appropriation bills in the out years is going to decline. You're not going to be able to do a $250 million supplemental appropriation. You're not going to be able to do, we've got a couple of years worth of those. That's not going to be possible when you don't have the big ending balances, and that's what this would result in, is not having big ending balances. So and this is exactly that, right? So the blue line is the top line. There you go. The blue line represents total available general fund. That includes a beginning balance. The bottom line includes total expenditures. If we added in a potential supplemental appropriation of some amount, you can see those two lines getting closer. What you don't want is those two lines to intersect. I'm telling you that simply because if they intersect, you got a bigger problem than what I'm trying to portray to you right here. Yes, it's what you're trying to avoid. And that's all I've got. I hope it didn't scare anybody too much. I just felt the need to make sure that you understood that there's a big situation that everybody needs to be aware of.
Well, the only thing that scares me about this, frankly, first off, thank you for doing this, and thank you for laying this out. That gives us an opportunity to gauge not just us on the legislative side, but also on the agency side of what to look for or what to try to plan for. The scary part of it is, I mentioned, is that we're only dealing with one small piece of the puzzle, which right now is the largest piece of the puzzle. The rest of the puzzle dealing with economic strains and other matters that may or may not occur, or that they will occur. We just don't know what they are, when they'll occur, and how it's going to affect us. So that's on top of everything else. That's kind of my concern. Any other questions from the body?
Just one comment on that, Mr. Chairman, if I may, and that is to follow up on what you said. The general fund revenue forecast that Kirk put out shows increasing receipts every year. That's assuming good continued economic growth.
Right, for everything other than.
And then, to the tune of 120, 150, 154, $143 million moving forward from 2024. Each year on top of each other. That's assuming everything is continuing to go well, still with reductions in in totals because of the interest rate.
Right.
And if we have an economic change that is not continued, that will do nothing but exacerbate these problems.
Absolutely.
One thing that a change in society is I don't know if anyone's aware of this, but we're entering Amazon Prime time. Which means it's Christmas in July. That will affect the SSUT. That's something an anomaly that has been created from the society rather than having and waiting till the end of the year. Now, that's kind of a foolish thing, but I use it as an illustration of how these things change and how the turning on a dime, it ain't a dime no more, but it can change quickly. Any other questions?
I have just a quick one, just a confirmation, because I think I heard you say this. On your general fund revenue forecast, I really like that page. As we know, when interest rates fall, that does spur different parts of the economy to do better. And you've already factored those in on that first column under total receipts. That's already been, in some form or fashion, it's already been factored in.
Yeah, it was picked up over that 10-year window that the projection was based on.
Very good. I just wanted to make sure.
Good catch. Anybody else?
Good report. Thank you.
Thank you.
Admiral, you're up.
Thanks, Kirk.
Admiral, I was on active duty when the Navy All-Nav came out and told all the sailors to remove their facial hair.
Yeah, that was a long time ago.
Yeah. I suppose you've received another?
We're dating ourselves. Actually, the Navy just changed their policy. As a retiree, you can wear a uniform with a beard now. You have to be a retiree. But I joke with people. Some may remember about a year ago, I couldn't grow any hair. I didn't have any hair. I was going through chemotherapy, so I'm making up for lost time.
Thank you for being here. You're up. I hear you have a presentation for us.
I do,
We're anxious
Senator.
to see it.
And please ask any questions. Some of this, admittedly, is a little bit confusing. I'm going to give you a sneak preview of some things we have coming up, some exciting news, especially the opening of our state veterans home. But I'm going to start by explaining what's the difference between the federal VA and the Alabama Department of Veterans Affairs, because there's constant confusion over that, and they're delineated roles that I'll go through. So I usually start with this lately. You hear so much in the news about the status of the military recruiting, retention, operational readiness. This is a great quote, and I'm actually going to read. I promise most slides I won't read, but this is a great quote. The willingness with which our young people are likely to serve in any war, no matter how justified, shall be directly proportional to how they perceive the veterans of earlier wars were treated and appreciated by their nation. That's a great quote. Anybody want to guess who said that? My staff can't answer. Believe it or not, that was said by George Washington. So this concept, the linkage between military readiness, recruiting, operational readiness, and how we treat our veterans is vitally important. And there's a role for both the federal government and the state to play in taking care of veterans. Look, I'm a little biased. I spent 31 years in uniform in the Army and the Navy, but I really believe this. I think there is a role for both the federal and the state governments and the private sector in taking care of veterans. And you're going to hear that theme throughout my presentation today. So big confusion. What's the difference between the U.S. Department of Veterans Affairs, or VA, and the Alabama Department of Veterans Affairs? There are clear differences. There's no competition. Dispel any stereotypes that you have about cooperation between the federal government and the state government. I tell you, this relationship in Alabama is about as solid a partnership as you can find. There is no competition. There's no overlap. Everything that we do at the state level is complementary to the role that the federal VA plays. I describe it really as a symbiotic relationship. We pick up where the federal VA leaves off. We are in many respects the customer service arm of the federal VA out in the community, and I'll show you examples of that in a minute. But a very close relationship. I think it is important, especially for your constituents, when you're advising them, because constituent concerns about Veterans Affairs they're a big part of those constituent calls you get. I'm going to explain very quickly what the federal VA does, just a quick overview. So there are 3 separate administrations in the federal VA. We have to deal with these separate administrations. They really don't link up fully until you get to the Washington, D.C. level. So we have really strong relationships with all of these administrations: the Veterans Health Administration, the Veterans Benefits Administration, and the National Cemetery Administration. All of these are partnerships. And to break them down very quickly, the Veterans Health Administration, many of you are probably familiar with this. The delineation is the federal VA is in charge of short-term medical needs of veterans, and they do it through their hospitals, their community-based outpatient clinics, and something that a lot of people are not aware of, vet centers. Very important mission for those vet centers as we see a rise in well-being and mental health issues for veterans. And to let you know, they have a big presence in Alabama, the feds do, with the Veterans Health Administration. That's the location of the hospitals or medical centers, all of the outpatient clinics in Alabama, and the vet centers, which are usually in discrete locations given the nature of their business with mental health, psychological counseling. And we work with all of these facilities. The second administration is the Veterans Benefits Administration. Basically, any direct payment that goes to an individual veteran, everything from the GI Bill, the home loan program, vocational rehab, survivor benefits, pension programs, those direct checks. They actually have a regional office here in Montgomery, out on Perry Hill in that complex, with an SES, Senior Executive Service Level official, Corey Hawthorne. Great partnership with him. We talk with him and his staff literally every day, probably hundreds of times per day. Last but certainly not least, a lot of people don't like to talk about this, but the last service that we provide to veterans are burial services. And this is a pure partnership, and I'm going to keep coming back to this because there's a real need. There's a growing demand for cemetery services in the veterans community. We're a little behind in Alabama, and I'm going to tell you later on what we're doing to catch up with that demand. And we're seeing that nationwide as we see increasing deaths of Korean War veterans. Not a lot of World War II veterans left, but Korean War veterans and now Vietnam veterans. And I'll talk about that a little later on. So every state and territory has its own Department of Veterans Affairs, and we're all part of something called the National Association of State Directors of Veterans Affairs, which is arranged on a regional basis. 2 weeks ago, we actually hosted the Southeastern Regional Conference of NASDVA, as it's called, right here at our headquarters. So all of my colleagues from Virginia down through Mississippi took part in that. Great conversations. We had senior federal officials, really good dialogue amongst all of the states and territories and the federal VA. It's a really good partnership. This is our mission. So 2 words out of that. It's always been our mission to assist veterans in Alabama. No ulterior motives. We are here for those veterans, their family members. We also take care of the active duty, the Alabama National Guard as well. Our growth industry these days is promoting awareness. I'll be honest with you, we were behind in this area for decades. We were not doing a great job in getting the word out to veterans on the services and benefits that they were eligible for. Services and benefits don't do people much good if they're not aware what they're eligible for. So we've really stepped up that mission in the last few years, and I'll talk about that in a little more detail. So us by the numbers, Kirk did a great job with numbers, but we've got a few, and I'll go through these quickly. We were founded in 1945 as a department right at the end of World War II, when so many of the federal programs like the GI Bill were coming out. Most states established their own state department at that time. And the end of World War II was a pretty earth-shattering change in Veterans Affairs nationwide. Until recently, we had a big change, which I'll talk about with the PACT Act. We're organized quite different from most state agencies. Most of our employees are contract employees by law. If you add up our civil service employees, many of whom are non-merit employees, to give us kind of a corporate private sector model, and our contract employees, we have about 1,200 people that ultimately report to our department in running our services. We have a very small headquarters here in Alabama, in Montgomery. We only have about 20 people here in Montgomery. The vast majority of our 1,200 employees that report to us are spread all over the state, every single corner of the state, and I'll show you a map. Here's my proudest statistic. We serve approximately 400,000 Alabama veterans. Then you add up their family members and active duty, National Guard. You're talking almost a quarter of the state of Alabama that we consider our client base. That's a significant constituency that we take care of. We deal with a lot of money. Our annual budget for next year is projected to be about $230 million, and I'll give a breakdown of our accounts and how we collect that money and how we dispense it and all of our missions here shortly. This is really unique for us, especially amongst when you compare us to other states. We are overseen, this was set up in 1945, we are overseen by a 17-member state board of Veterans Affairs. They operate a lot like a corporate board of directors. It's a great model, I think. The governor chairs that state board. The other 16 members, by Alabama statute, are made up of direct representatives of the large veteran service organizations appointed by the governor. So the governor chairs, she appoints the other 16 members, and we think that gives us direct accountability to the veterans and the citizens of Alabama. And I will tell you, I'm not just saying this because some of them are here, but those board members, they hold us accountable. They really do act much like a corporate board of directors. They hire a commissioner on a competitive, nonpartisan, apolitical basis for a 4-year term, and they do a pretty good job holding our feet to the fire, taking care of veterans in the state of Alabama. That's the membership there. Let me give you one example. One gent, I mean, all of our board members are great. I'm not just saying that because some of them are here. We have a representative from POWs, Keith Lewis. He wouldn't mind me saying this. Shot down over Vietnam. Was a POW in the Hanoi Hilton for many years, tortured. He serves on our board. I mean, you talk about every time I go to a board meeting, I look him in the face, I say, we need to be accountable to those veterans out there and take care of them. We get a lot of other oversight. In addition to the State Board of Veterans Affairs, we may be the most looked at department, both by the feds and the state. We get inspected by the Alabama Department of Public Health, the feds, the Veterans Health Administration look at our state veterans home. In fact, we had a survey team show up unexpectedly by surprise this morning at our home in Huntsville. They'll be there for a few days. Long-term care ombudsman, the Alabama Board of Examiners of Public Accounts, they just completed a major audit a couple of weeks ago of our federal expenditures for our state veterans homes. No significant findings, I'm proud to report. We also get looked at by the Office of the State Auditor. We have almost 9,000 property line items. The last audit we had of those, 100% accountability. We're proud of that. We got an award for that. Not one line item unaccounted for. And we also get inspected by the National Cemetery Administration. We have to pass all of those inspections to say certified, and more importantly, to continue receiving federal operating dollars, and that is vital for us. Here's why. Almost half of our budget comes from federal money through various programs. We obviously simply could not survive without those federal dollars flowing into us. They pay for the operation of our state veterans homes and the operation of our veterans cemetery down in Spanish Fort. The other funding is we do, in limited cases, collect some fees from our clientele on our state veterans home and for cemetery services, but those are pretty minuscule. Another thing unique, we kind of operate like a corporation in that we have separate accounts that we pay for our operations out of. Surprisingly, Kirk talked about the general fund in detail. That was actually pretty fascinating. Very little of our money comes out of the general fund, and I've got a pie chart breakdown of that here in just a moment. We do use the Education Trust Fund because, as you'll see, one of our missions is a dependent scholarship program, and I'll talk about that in detail in a little bit. In the 1980s, when the legislature established our state veterans home program, they also set up a fund called the Veterans Home Trust Fund that we use to collect money and to pay for the operation of our state veterans homes. And last but certainly not least, in 1997, the legislature established the Veterans Assistance Fund. The best way I can describe this is both a reserve fund and a revolving fund for us. We could not do our mission without the Veterans Assistance Fund. There are some misconceptions about that. People think, oh, just have all this money lying around in that. As a revolving fund, it pays for things like the construction of our current state veterans home that we're building in Enterprise. We could not have built that home without the Veterans Assistance Fund, and we are substantially drawing that down as we complete construction of that home, which I'll show you here in just a minute. So the proportion of those accounts in our operating budget, fairly even mix. Look at that. The general fund is only about 2% of our expenditures. So we're not like other agencies that, you know, a big proportion of their budget comes out of the general fund. We, in practical terms, we don't have a lot of what's called discretionary spending. We know how much it costs to operate a state veterans home and a cemetery every year. So we do have some special projects that we have to use the Veterans Assistance Fund, especially. We're doing that pretty heavily now to pay for a new state veterans home. Again, and I'll go into detail about that here shortly. Am I doing any questions at all? Must be doing okay. All right. More importantly, here's what we do with those dollars. These are our major missions that we provide the veterans and their families in Alabama. And I generally talk about this in the life cycle of a veteran. So someone takes off their military uniform, they're leaving active duty or a deployment or something like that, and they become a veteran. Their first usual contact is through a veteran service office, which we have all over the state. They usually literally walk into those offices. We average, believe it or not, about 25,000 contacts with veterans every single month in our veteran service offices. And it usually starts with a veteran comes home to Alabama or settles here, and they walk into one of those veteran service offices, and we start helping them with their services and benefits. Along the way, they may take advantage of things like the Dependent Scholarship Program, which I'll talk about here shortly. Unique. So the feds have the GI Bill, which is a scholarship program for veterans. Alabama augments that with a Dependent Scholarship Program for the dependents of disabled veterans. And a lot of states have versions of scholarship programs in their states that supplement the GI Bill. Along the way, most veterans are doing great, but they may need a little help, sometimes a hand up even. We've really gotten in the business of awareness programs, partnerships, and what we call veteran well-being programs, and I'll talk about that. And look, some of this is the good, the bad, and the ugly is we have some pretty serious problems with veteran well-being issues in the state with veteran suicides, opioid addictions, and I'll talk about that. Finally, as they move through that life cycle, if they become disabled or elderly and need long-term care, the states are in charge of long-term care for veterans, and we're proud of our state veterans home, which I'll show you, and you're going to get a sneak preview of our newest home, which we're going to open in just a couple of months. You'll be some of the first to see it. Some have seen the pictures and videos I'm going to show. And then last but certainly not least are those cemetery services that we provide, and we're proud of that. A dignified place of perpetual care for those veterans who have served their country. Let me break those down a little bit. The veteran service offices, we have 62 of those around the state. We're in 61 counties. Jefferson County actually has 2 offices. That's a good news story. It's not complete. There are 67 counties. We're obligated to provide services in all counties. Here's the good news, though. Despite COVID, increase in workload due to the Federal PACT Act, in the last about 3 years, we've added 12 new veteran service offices in the state. without an increase in budget. How did we do that? Well, we got a more efficient model. We've established what we call itinerant offices around the state. What that means is we will take an adjoining county, and one of those members of that office will go to the adjoining county 1 or 2 days a week in a permanent physical location and operate that itinerant office. About 5 years ago, when I became commissioner, I looked at the map and I said, gosh, we're missing whole swaths of the state, and some of those are the areas most in need of veteran services. They tended to be the poorer, more rural areas of the state. So we pulled out all the stops, great partnerships with the counties. It is a pure partnership. They provide the office space, we provide the personnel, and it's just a great partnership. So we've added those 12 counties in the last 36 months. I had the pleasure of going up to Tuscumbia and meeting with Representative Underwood and several others within the past few weeks. Our next goal is to put an itinerant office in Colbert County, so that'll get us in 62 counties. And if it kills me, we're going to get back in all 67 counties eventually. We form a legal relationship with those veterans. When they walk into the office, they sign a power of attorney where we can legally represent them before the federal VA. Our veteran service officers are accredited by the federal VA. They get an access card where they can get into the federal records. They have to be certified, tested. It's a long process to get them up to speed so they're qualified and certified to be accredited service officers. But our relationship with them doesn't end with that administrative process in the office. If a veteran files a claim with the federal VA, they adjudicate it, and the veteran is not happy with that outcome, they have an automatic right to an administrative appeal of that decision. We represent those veterans free of charge in that appellate process, and we advocate for them. We have a specialized office here in Montgomery out at the federal facility that handles those appeals. Last year, big development. This is a totally different department from what it was 4 years ago. We signed a memorandum of understanding with the National Veterans Legal Services Program. Now, if a veteran needs to jump into federal court and challenge a Veterans Affairs decision, we can arrange free representation for that veteran, literally all the way up to the U.S. Supreme Court if necessary. We've referred some cases to NVLSP already, so that's been a successful relationship.
Admiral, that's a big change.
It was a
Very
big
positive
change. Because before this, a veteran, even if we felt like they had a good case, if they were denied at the claims phase and then the appeal, the administrative, that's it. They were on their own. They had to go hire an attorney and spend a lot of money usually. But now we can do it through these pro bono services. Biggest change. So I alluded to this earlier. So really the modern Veterans Affairs system was established at the end of World War II. This is the biggest change in veterans benefits since World War II, hands down. In 2022, U.S. Congress passed and the President signed the Honoring Our Promise to Address Comprehensive Toxics Act, or the PACT Act. Huge change. This turned veterans benefits upside down. What it did is, from the Vietnam era on, from Agent Orange exposures, burn pits, you name it, any toxic exposures, it created presumptive conditions for those veterans. A lot of those veterans could not support a claim because the records weren't there. The DOD didn't have the correct records. This is basically, in lawyer terms, switched the burden of proof. Now there's a presumption that if a veteran has one of these presumptive conditions and they served in a particular campaign, the law presumes that their physical ailment is connected to that military service. It's really changed things. A lot of people were concerned about the national expense on this. So far in 2 years, it's cost about $1.5 billion. I mean, that's a lot of money, but when you compare it to other federal programs, that's really not a lot, comparatively speaking. You're probably familiar with part of this because, like me, you're probably a little tired of seeing the ads for Camp Lejeune. That was a component of the PACT Act. Interesting little factoid, in the original version of this bill, the PACT Act bill, there were similar protections for Fort McClellan veterans. Fort McClellan was the home of the Army Chemical School up in Anniston, Alabama. I lived in Anniston for 10 years. I was actually the city manager in Anniston for a couple of years. I'm quite familiar with that. We hear that issue all the time, that soldiers, sailors, airmen, and Marines who went through Fort McClellan had toxic exposures. And they handled some pretty nasty stuff at Fort McClellan. You're talking VX and GB nerve agent, herbicides, radiological materials, all the way back to World War I, and we hear, frankly, some horror stories of veterans who have physical ailments. There's probably more to come on that. I'm not sure why, but the bill was amended, and that was some of the protections for Fort McClellan acts were toned way down, but it keeps coming back up. And I mentioned that because it was here in Alabama. All right, so there is a return on investment in all this. Our veteran service offices are very tenacious in going after benefits for Alabama veterans, and I mean that sincerely. In the 5 years I've been commissioner, we're proud of this. We have gone from number 10 per capita veterans benefits to number 1 in the country. And I got to tell you, it ain't me. It's our veteran service offices, those dedicated VSOs out there in your counties that go after those benefits that have already been appropriated by the U.S. Congress. Their job is to link up Alabama veterans with those benefits that they earn from their uniformed services. And they do a great job. The return on investment, fiscal year 2023, the total federal VA expenditures in Alabama, $5.85 billion. If that were an industry, that'd be a pretty impressive industry. Now, yeah, it's government dollars. I'm a kind of a small government stewardship of every penny, but that's a lot of money that our veteran service offices go after. So there's a return on investment. And when we approach a county about putting a veteran service office and they look at the facts and figures like this, they say, that's a lot of money potentially coming into my county. So they get it. The Dependent Scholarship Program, great benefit that the state of Alabama provides for the dependents of disabled veterans. And I got to tell you, not to sound corny, but the families of veterans often have the toughest job in the military. I got to tell you that. I've deployed to 5 combat zones, and every time I left, my family, my wife, say, I'll see you in 9 months. You take care of the kids, the house, and all that. So this, I'm proud of the state of Alabama. This scholarship program has been around for, gosh, over 75 years. There have been some big changes in this. You look at the numbers there, we have, gosh, almost 16,000 students enrolled in this program right now. It's allowed a lot of kids, dependents, to go to higher education that otherwise would not have been able to afford it. There have been some really big changes in this in the last few years, and I'm going to be candid about one of them. In 2014 and 2017, before I was commissioner, there were valid concerns about the growing budget for this dependent scholarship program, completely reasonable concerns. Gerald Dial, who I've known for about 20 years, was really concerned about the growing budget and introduced some legislative changes that passed. The biggest change was it raised the disability rating for eligibility for the scholarship program from 20% to 40%. Well, that was a huge change. Now we've got the tracking figures. So I just want to be candid. Since those 2017 changes, what has occurred is about a $35 million a year drop in that dependent scholarship program. That's a significant cut in that dependent scholarship program. The reason I know it is because all the colleges call and complain because they get a lot of money through this scholarship program. I mean, for example, we send over $5 million per year to the University of Alabama, but that's down from what it used to be. When I talked to Gerald Dial recently, I said, I understand the budget concerns back in 2014, 2017, but did you know it's realistically resulted in about a $35 million a year cut in that dependent scholarship program? And he seemed really surprised at that. I don't mean any editorial comment by that, I promise. It's a fact, and I'm not sure people are aware of that. This is a good thing. Most recent session, Representative Starnes introduced a bill to raise the cap that we were paying on the dependent scholarship program. That's a good thing. It had not been raised in a while, so it went from $250 per semester hour to $400 per semester hour. That takes effect in just a few days, July 31st, so it'll help those kids that are going off to fall classes. Here's a big change. For 75 years, this was a paper-based application. It was onerous, horrendous, inefficient. We relied on the U.S. mail. It was just, we had not jumped into the 21st century. So a couple of years ago, we said it is time to realize it's 2023, 2024. So we have converted this whole process to an online internet-based portal. We rolled that out last year. It's been a smashing success. And I got to tell you, having been through many rollouts of government IT systems. I was a little nervous, but this went off without a hitch, and we've heard nothing but accolades. It's a lot easier, much more efficient, especially for younger folks who are applying for the scholarship program to just go online and upload the documents. We send money to a lot of schools. These are the state colleges. There are 35 state colleges, universities. We send those scholarship dollars. We have a great relationship with all of these colleges. We train them up on the scholarship program. A couple of years ago, the legislature, I think a good thing, added 14 private colleges for the first time. So now we send scholarship dollars to private colleges. It's down to 13 because one of them was Birmingham Southern, so I had to take them off the list. But we're up to 48 institutions of higher education that we send those scholarship dollars to. All right, here's our growth industry. And there's no way for me to sugarcoat this portion of my presentation. I'm just going to be honest. These are painful topics, and I just want to tell you that up front. We have really made this our push the last few years to get the word out to veterans about benefits and services and even those difficult topics that veterans are facing. One of the things we did is we completely redid all of our internet interface with veterans. We redid our website completely, made it much more user-friendly, a one-stop shop for all things veteran-related. We are now in the social media industry. 4 years ago, we established a whole new office. We didn't even have an outreach and engagement office. Now we have an outreach and engagement office whose mission is to partner with the feds, with the private sector, and get the word out to veterans. We're all over social media. Sometimes that's a good thing. Sometimes it's not so great, but it's a necessary tool these days, especially with younger veterans. Here's the tough part of our jobs. And I'm not proud in Alabama of these stats that I have to talk about. I'm proud of the fact that we have 400,000 veterans. I'm not proud that we have one of the worst veteran suicide rates, if not the worst. Every year, we are right at the bottom when it comes to veteran suicide statistics per capita. I'm not going to read these. You look at some of these horrifying statistics. Here's the bottom line. In Alabama, a veteran takes his or her own life every 2.4 days on average. That's probably an inaccurate figure. I've had plenty of coroners say, if there's any doubt, they don't report a veteran suicide as suicide. They report it as an accidental death. So we're pretty certain that number is actually kind of low. And a lot of those veterans are not reaching out for the help that they need through a combination of factors. Excuse me. What are we trying to do to resolve that? Well, about 4 years ago, we were one of the first states to form a partnership with the federal VA and the U.S. Department of Health and Human Services on something called the National Governor's Challenge. Governor Ivey was kind enough to allow us to participate in that. We were one of the first states. Now, over the last 4 years, all 50 states have joined that. We have a lot of state, federal, and private sector partners to get the word out, but we've done a lot more. And here's why. There are unique factors that veterans face that cause some of these issues. Service-related physical injuries, some unique mental health issues. You all know probably about PTSD, but there are other mental health issues that are rather unique to the veteran community. Difficult topics like military sexual trauma, just the transition to civilian life, a strong stigma that military and veterans have towards seeking help for mental health issues. That's a real issue we're trying to deal with. And something I'll talk about, Chairman Reynolds knows this, overprescription of especially opioids. This has been kind of a self-inflicted wound in the Veterans Affairs community with overprescription of opioids to veterans, and now we're paying a horrible price for it. I'm not going to read these. There's been study after study after study of these issues, of suicide, of addictions in the veteran population. The bottom line is it disproportionately, by a wide margin, affects the veteran community. The Defense Health Agency research indicates that veterans die from opioid overdoses at roughly twice the rate of the general population. You look at the mortality rates, they're going up. Over a 9-year period, they increased by 93.4% for overdoses involving opioids. Look, again, I don't mean to get on a soapbox. This is a serious, serious issue in the veteran community. And on, study after study that talks about the reasons for it, the military experiences that lead to all of these problems that we're facing. Again, U.S. Department of Veterans Affairs documents that veterans are twice as likely to die from an accidental opioid overdose. Much of that deals with chronic pain issues. There's the Journal of American Medical Association, talks about the chronic pain issues amongst veterans. There's a direct link between drug use, opioids, and suicides, a direct link, and all of the other holistic issues that we look at with veterans. In response to this, Alabama is slated to get a lot of opioid settlement funds. Chairman Reynolds also chairs the distribution committee. Our bosses, the State Board of Veterans Affairs, have respectfully asked, don't forget about veterans. Please do not forget about veterans. They are disproportionately affected by the opioid crisis. They need to be remembered in the distribution of those funds to assist the community of veterans in Alabama. We're doing a lot more.
Admiral, I may just stop you right there real quick. So just want to thank you because you participated in that as well. And I think with your assistance, we've got adequate verbiage in the statewide distribution plan of those funds to prioritize treatment for our veterans. And those the grants will be opening soon through the Alabama Department of Mental Health, but both the prevention, treatment, recovery grants will be available to all the veterans recovery organizations as well as the pilot program. I see John out there, and that'll be opening up for the pilot program soon. So glad to see that moving forward.
Thanks, Mr. Chair. So we're doing a lot more. In the last 4 years, not a lot of money. We're grateful the legislature gave us $300,000 for information campaign, mainly to support the 988 system. We recently received permission to use $500,000 for information campaign to advertise the Veteran Crisis Line and other programs. But we've gone all over the state in the last few years. We've had town halls and fairs to talk specifically about some of these issues: mental health, suicide, opioid addictions. We've worked with colleges, universities, and high schools to raise awareness through a visual reminder campaign called Operation We Remember, which is a flag display for, veterans who have taken their own life. Operation Resilience, we work with the active duty bases on keeping military and veterans out of crisis. We've tended to be a little reactive in history. We wait until veterans have problems and then we react to it. We're trying to keep veterans out of crisis situations now through training and education. In conjunction with that, we've established an independent website, vetsforhope.com, which is a one-stop shop for veterans' mental health and suicide prevention issues. A lot of other states are looking at that as a model and saying, wow, that's a good information source. Last fall, we sponsored a national traumatic brain injury conference in Birmingham. We had experts from all over the country to talk about that issue that disproportionately, by a long shot, affects the military and veteran community. And there's increasing evidence that even low-level concussive effects from artillery fire and even small weapons fire now is causing long-term traumatic brain injuries in veterans. The science is kind of catching up now. A lot of external partnerships. We do Operation Iron Ruck with the University of Alabama and Auburn University, which is an awareness campaign right before the Iron Bowl. They march 151 miles between the two stadiums to raise awareness, and we participate in that. Last but certainly not least, and these are just examples, there are over 20 veteran treatment courts in the state, a great model with a very good success rate, very low recidivism rates, and the reason is they use a peer-based veteran-to-veteran model in mentoring and counseling, and that we find is the best model out there because veterans will talk to another veteran when they won't talk to their spouse, their clergy, or even a clinician. So those veteran treatment courts, we try to support any way we can. A big change in the law. The Veterans Crisis Line. Some are probably familiar with the General Crisis Line, which is 988. A subset of that, you dial 988 and you're prompted to press 1, and it links you with veteran-specific services for crisis intervention. We have been advertising this quite a bit. With the $300,000 we got from the legislature, we embarked on a billboard and public service announcement campaign that's been very successful. I'm going to ask Jason. Jason, can you pull up those public service announcements? They're 30 seconds, but I want you to see these. These are pretty powerful. I tell you, I still get choked up when I watch these. He's going to cue those up, and I think you'll find these very good use of the dollars that you gave us around the state of Alabama. And we've had millions of showings of these. First one is aimed at Vietnam veterans largely.
I need to give you something.
Sure, Dad, what's that?
I need you to hold on to this for me.
Of course.
If you or a veteran you know has had thoughts of suicide, call 988 now.
How about we sit and talk for a while, okay?
It's private, free, and accessible 24/7.
I'd like that.
You are not alone.
And then the second one is aimed at younger and minority veterans, especially Iraq, Afghanistan veterans. And the
challenges faced by our nation's.
That's not part of it. The inevitable YouTube ads. Jason's queuing up the second one. These have gotten accolades. Even the VA secretary called me and said, wow, those are really good public service announcements. Here we go with the second one. Listen to the background noises in the beginning of this.
Well, everything looks great. How are you feeling? Actually, well.
If you've had thoughts of harming yourself, call 988 or talk to someone you trust.
I'm here to talk about anything bothering you.
You are not alone.
So again, those are just part of the information push we've engaged in over the last few years just to raise awareness and get the word out. Look, if nothing else, you call that 988 number and press 1 and you'll be directed to veteran-tailored services. Not a panacea. It's just one tool. I know funding of the whole 988 line has been an issue. I won't get into that, but we see this as one tool that's available out there for veterans. There have been some other legislative issues. I won't spend any time on this. We have, right now, we're working with Troy University and implementing a grant program for nonprofits and institutions of higher education that provide services to veterans called the Supporting Alabama's Veterans Grant Program. I talked about the opioid settlement funds already. Senator Andrew Jones is not here, but some of you are probably familiar. This legislative session, there was a bill sponsored by Senator Andrew Jones and Representative Chip Brown we're proud of. I want to give them kudos for introducing the Veterans Access to Care bill. The final version was quite different from the original version, but there is a path forward. And I do want to give kudos because sometimes, I'll be honest with you, veterans feel like, does anybody really care about us? Well, this was a direct action aimed at the veteran community trying to improve on some of the issues that I've talked about, the well-being issues, the suicide issue, the opioid addiction issues, and I got to give them credit because veterans notice and they remember they cared and they tried to do something concrete to help veterans. All right, moving right along. I promise you I'm in the home stretch, and this is where it gets fun. This is a good news story. So state veterans homes, as I mentioned, the feds are in charge of short-term medical care for veterans. The states handle long-term care. In the 1980s, the legislature authorized us to establish a system of state veterans homes. We now have 4 state veterans homes in Huntsville, Pell City, Alexander City, and Bay Minette. We are required by state statute to operate those via a contractor. I get a lot of questions, why do you do that? Well, we don't have any choice. We have to under state law, and it's been a successful model. And frankly, it allows us more flexibility in hiring, terminating, selecting employees. It's a very good model. Our state veterans homes get accolades and awards all over the country. We have delegations from all over the U.S. that visit our homes. And I think you're going to see why here in just a second. So here they are. Our oldest home is in Alexander City, opened in 1989, but it underwent a major renovation in 2015. It still looks pretty much brand new. Skilled nursing facility. In 1995, we opened 2 homes at opposite ends of the state, the same design, so that's why they look alike, one in Huntsville and one down in Bay Minette at the opposite end of the state, down in Baldwin County. They underwent major renovations in 2020. I'm telling you, you want a definition of insanity, you try a major renovation of a facility right in the middle of COVID. That ain't easy, but we had already committed to this. The contracts are signed, and we pushed forward and got them done by moving people around and following guidelines. So those homes look brand new. Our current newest home opened in 2012. It's a mixture of assisted living and skilled nursing right off of I-20, right behind St. Vincent's Hospital. Beautiful. This is the one we get visitors from all over the country because it's kind of the new model for state veterans homes. But nice problem to have, perhaps. 5 years ago, when I became commissioner, we had the longest waiting list easily of any state in the country to get into our state veterans homes. We didn't have enough state veterans homes. Give you an example, our neighbor to the west, Mississippi, has 5 state veterans homes. Their population of veterans is 150,000. So soon we'll have our 5th veterans home, the same number as Mississippi, but a lot more veterans in Alabama. Mississippi does not have a waiting list. Last count, I had a waiting list of 428 people waiting to get into our state veterans homes. So 5, 6 years ago, we said we got to solve this at least partially, and we started on a new project to build a 5th veterans home. We did a feasibility study that showed, yep, you need at least 1 more home. And the area of the state most in need is the Wiregrass region. We went through a 6-month selection process. 12 municipalities submitted proposals. Eventually, a site was selected objectively, competitively in Enterprise, right near Fort Novacell. A name was selected for the home on a competitive basis. It will be named after Command Sergeant Major Benny G. Atkins, Medal of Honor recipient from Alabama, settled in Alabama, became an accountant and a professor after getting seriously wounded in the Vietnam War. Great gentleman. If anybody in here had the pleasure of knowing him, he passed away, ironically, from COVID just a few years ago, but we're proud we're naming that facility after him. Whew, what a project. Again, in the midst of COVID, a little bit of insanity trying to complete this project, but we pulled it off. There was a point about 3 years ago, we seriously considered canceling this project because of the budget situation and, frankly, the inflation that we were facing. But I'm proud to say, once we got the money locked in, we signed the contract, we are on time and on budget. I know that's hard to believe for a government project, but we had always said we're going to open this facility in the summer of 2024. We're going to make it by about a week. Our grand opening is going to be on September 13th, 2024, and I'm going to give you a sneak preview. You are some of the first people to see this. We just completed the construction of the facility about 2 weeks ago, and now we're furnishing it. So I want you to feast your eyes on this. You're some of the first to see this video. You should be proud of this. This is an investment that Alabama made for the betterment of veterans, and I want you to see what you're getting. So a beautiful facility. We're in the process of furnishing. Gives us room for expansion in the future. Beautiful area of Coffee County, plenty of green space around. We picked a farmhouse theme for this, given the kind of rural setting for it. It's pretty near Fort Novosel, formerly known as Fort Rucker. They've done a lot of the landscaping. They're working on the interior, the final touches on it. It's going to be
Admiral,
nice.
That's great. So when's the 6th?
Well, we're going to talk about that in just a moment. You beat me to the punch. Private rooms, private baths, full medical facilities, 24-hour skilled nursing care, state-of-the-art facility. We're already getting other states chomping at the bit that want to come look at this facility. But man, this has been quite an undertaking. I mean, dispel any stereotypes you have about long-term care and nursing homes. It's a beautiful facility. All right, I'm almost done. So the last service we provide is state cemetery services. This is a pure partnership, and I have to give you a broad overview. The national goal established by the U.S. Congress is to have a veteran cemetery, believe it or not, within 75 miles of every single veteran in the United States. We're close to meeting that goal nationwide. We're about 95% towards meeting that goal. Unfortunately, Alabama is one of the stumbling blocks. We have a big geographic hole up in North Alabama that I'll get to shortly. But we were running out of space. Right now, there are 3 active cemeteries in Alabama. This is supposed to be a shared responsibility between the feds and the state. We have 2 federal cemeteries in Alabama, in Montevallo and Fort Mitchell. The largest in acreage is the state cemetery down in Spanish Fort that we own, we operate, we hire the employees. We built this facility about 12 years ago with an expected active lifespan of 100 years, but we knew we would have to do some expansions. Running a veteran cemetery is totally different from a private cemetery, and not to be crude, but you know, it's not a matter of when someone passes away, you dig a hole and bury them. You have to build out crypt fields about 10 years in advance with concrete burial vaults laid out meticulously. We were running out of space in our cemetery. There have also been some changes in the law. Believe it or not, until recently, we could not bury regular members of the National Guard and Reserve in our veteran cemeteries, which we found that unconscionable almost. So we worked with the Alabama congressional delegation and got in favor of changing the law. We were the 3rd state in the union, I'm proud to say, that implemented a new federal law that allows us under the Burial Equity Act to bury Alabama National Guardsmen and reservists from Alabama in our state veteran cemetery. And we started that in May of 2023, a new benefit for those who also served. We get a lot of community involvement in all of our cemeteries, both federal and state. We're proud of that. But a nice problem to have, I guess. The demand curve outpaced our original predictions. We were about to run out of space. So we went after federal grant dollars. We got $5 million to expand our cemetery in Spanish Fort. We did so. We got the money, did a groundbreaking in 2023, and then a year later, we opened the facility. Here's what's involved. You have to dig out about 10 feet of dirt, put in drainage systems, put concrete burial vaults with millimeter precision. Then you got to backfill. You got to build cremated remains spaces, columbarium walls, urn burials, and there's a growing demand for cremated remains. That has kind of surprised us. Then you backfill all the dirt. Then you put topsoil and sod down. There are about 4,000 new concrete burial vaults and columbarium spaces there that we expanded into. That will get us through about the next 10 years of demand for cemeteries down in South Alabama. So we're proud of that. We pulled off 2 major construction projects at the same time. We're not standing still. Here's our major projects coming up. First of all, we are in pretty desperate need of another veteran cemetery. One of those geographic holes is up in North Alabama, and it also is the fastest growing population of veterans in the state. It's time for us and the rest of Alabama to seriously consider a second state cemetery. The National Cemetery Association administration is pushing us for that. The Alabama congressional delegation is pushing us to establish a second state veteran cemetery up in North Alabama. I'm talking to Representative Strong's staff in the next couple of weeks and several other congressional staffs about this. The problem is there's really no federal dollars available for this. So we're going to have to look at using the Veterans Assistance Fund to fund that project. You're probably talking about a $20 million investment in something like that. But many other projects going on. The demand at our Spanish Fort Cemetery has grown to the point where we have to build a second committal shelter. We're actually causing traffic problems with funeral processions at our cemetery on Highway 225. We do have some extra projects at our new state veterans home in Enterprise. One of the tough decisions we had to make during COVID with inflation was we cut down on a lot of the outdoor amenities that we planned for this facility. We're going to have to play catch up with that, put some sidewalks and walking paths for especially wheelchair-bound residents. We have an issue with retention of our employees. Our veteran service officers, they have to be veterans. They have to be in a complete reclassification of our veteran service officer positions so we can compete a little bit better. We intend to continue with the grant program that we've had for several months now, the Supporting Alabama Veterans Grant Program, which we will probably ask the state board and the legislature for permission to dip into the Veterans Assistance Fund to support. And in answer to your question, Senator Albritton, at some point in the future, Alabama's going to have to consider a 6th state veterans home, probably in the western portion of the state, is my guess at this point, around Tuscaloosa, Demopolis, because we don't have one out there. We would go through the whole regular process, but you just do the math right now. We probably need some changes in the federal laws and regulations. That's why we're talking to the U.S. Congressional Delegation. They've inquired with us about changing some of the federal prescriptions on state veterans homes. But eventually, long term, we're probably going to have to look at a 6th state veterans home to keep up with demand, because we're going to have 174 beds in Enterprise. Well, you do the math. We've got 428 people on our waiting list right now to get into our homes. All right, people ask me this all the time. What are other states doing to support veterans? So we did a quick survey. I'm not going to read this. This is what some other states, both blue and red, are doing to support their veterans. This is not lobbying on my part, but I get asked this a lot. So pretty innovative things that other states are doing. Why is this important? Trust me, I'm biased. You want veterans to settle in Alabama. They bring skills. They're upstanding citizens. They bring security clearances, so they get hired by defense contractors. It's important to go after that population and convince them Alabama is a very veteran-friendly state, and you want to settle here and bring your experience and dollars. All right, I know that was a lot. I'm done. I'll be glad to answer any questions, Mr. Chair.
Thank you for a very thorough rendition. I appreciate your time and I appreciate everyone's attendance here. Any questions for the Admiral? Mm-hmm. Representative Witt.
Yeah, thank you, Mr. Chairman. Admiral, how many employees currently do you guys employ with the VA?
We have about 1,200 total contract and civil service employees that report to our department. Now, a small percentage, only about 140, I think it's about 140 are state civil servants. Many of those are non-merit employees. We have a lot of flexibility because we operate kind of in a private sector model.
So as I look over your financials, and I just look at things that jump out at me as I'm looking down through here, you know, I think I had a total of 129 employees at the end of 2023. Does that sound about accurate?
That's about right. Yeah, I think our authorization is about 140.
And in 2019, you had 117.
That's probably about right, yeah.
And then I saw a 34% increase in personnel cost and employee benefits, and you increased 12 employees.
Great question. So we've had, I'll be honest with you, we've had pretty serious hiring and retention issues. Here's an example. I can barely keep a caretaker staff at our cemetery. They're down in Baldwin County. Senator Elliott will tell you, a lot of construction, a lot of landscaping. Typically, we would train up caretakers on heavy equipment, get them certified, and then they leave to go right down the street somewhere else. So we had to reclassify all those positions to make it more competitive. It's been stable the last couple of years. A more serious issue we had were veteran service officers. we were paying those folks a pittance, and we were losing a lot of good people with experience. And it's a long training pipeline for those veteran service officers. They have to go through a training program. They have to take a test with the federal VA. They have to get certified and accredited as a service officer. So we actually did a pretty substantial pay increase to stabilize that workforce, and it's actually worked quite well.
Okay. And then the second question, I guess, and it's a follow-up regarding the scholarships.
Yes, sir.
That looks to me like that has fallen off. It was grants and benefits. That's where that would fall into that category, correct?
Yeah, that's accurate, yeah.
Because that's down about 48%. But then you look at professional fees and services. What does that entail? Because that is a 20% increase.
Yeah. All right, Dixie, I'm going to lean on you. Okay. So, yeah, great point. So when I went through the funds earlier, so we collect 46% of our budget comes from the federal government. A lot of that is in per diem payments. So the federal government pays a per diem per resident per day in the state veterans homes. Those rates have gone up pretty substantially with inflation over the last few years. So most of that is a reflection of the increased federal per diem dollars coming into that account. Is that a good synopsis, Dixie?
Okay.
That makes sense?
Yeah, I thank you. Thank you, Adam.
Yes, sir.
Thank you, Mr. Chairman.
Any other questions? Thank you, Admiral. Kirk, you got a couple of things you wanted to bring back up to us real quick?
Thank you, Admiral, and thank you for all the veterans in the room. Thank you for your service, and appreciate you being here and your passion to support the Admiral and his budget. Kurt?
Just briefly. So, and I didn't do this earlier, I should have. We have given you information about the agencies coming today. What that information includes is a 5-year look back, and I think Representative Witt was referring to it, about the receipts and expenditures of the agencies. We get into the weeds a little bit about the federal funds, pulling out and showing specifically coronavirus relief fund money, ARPA money, where that applies. VA is a little different than most of the agencies are used to looking at, as Admiral indicated. They're kind of the inverse model. They get more money from the feds than we give them from the state, and the biggest thing we give them from the state is from the Education Trust Fund, and the reason that has gone down substantially over that 5-year period is there was a major revision to the VA scholarship program, and I think in 18 or 19. Prior to that, that number was an open-ended appropriation. Basically, the ETF had to give them whatever it cost for the previous year, and that number had gotten up to like $95 million. And so there was a revision to the program. The costs have come down since then to $65 million over the last couple of years. I think this year, the 2023 number was $63 million and some change. And I think the number we appropriated for 25 is even less than that. So it's just a matter of the revisions to the program and the number of people receiving the scholarships is the reason why that's been going down, not necessarily because of anything otherwise. It's just a matter of that. So that's the reason why their overall state money has gone down, is that was the biggest component of their state money was for the scholarship program. And again, this is actual revenues and expenditures between 19 and 23. It does not pick up the current year's budget for 24 because it's not over yet, or the budgeted 25 budget that begins in October. We've got the same information for each one of the agencies that you've got on your schedule to come before you. As well as there's a separate spreadsheet that's a rundown of similar information as far as receipts for every agency over the last 5 years and how that's grown or declined. There's very few declines over that period of time, not only State General Fund, Education Trust Fund, but other state funds as well. So there's that rundown as a separate page. All of that information, as well as the presentations today, are on LSA's website under special reports. Anybody can go there and get them if you want to. So,
Admiral Davis, this presentation, is that online, available online on your website?
If he will share it with us, we'll be glad to add it to the other stuff that's already there.
Wonderful. All right, thank you. Any other questions? If not, we'll break for lunch. We'll be back here at 12:30.